Chagas disease is a potentially life-threatening illness transmitted by the kissing bug, which carries the Trypanosoma cruzi parasite. It is mostly found in Central and South America. It is estimated that it infects as many as 11 million people. The kissing bug often bites victims on their lips during sleep and leaves behind parasite-laden feces. The disease has two phases. A 2-month acute stage is marked by symptoms including headache, fever, diarrhea, vomiting, fatigue, body aches, skin rashes, and swelling in one eye. Up to 90% of cases are cured when treated during the acute phase. If untreated, the disease progresses to a lifelong chronic phase. The parasites can affect the heart and digestive system, causing damage in these areas, and may eventually cause heart failure and death. Cure rates decrease with time.
Chagas disease is also known as American trypanosomiasis and is the cause of 12,500 deaths every year. It's estimated that between 8 and 10 million people suffer from the disease. It affects mainly Latin America, but as a result of the increase in global migration and mobility, cases have also been reported in Europe, the United States, Australia and Japan. The Chagas vector is the kissing bug. People infected with the Trypanosoma cruzi parasite could show some sign or symptom at the time of infection. In a small number of cases, acute Chagas disease causes death. But for the majority, the symptoms go unnoticed, and for years those infected have no further problems. In the chronic phase, up to 30% will develop heart problems, and 10% will have damage to the gastrointestinal tract, both of which can cause irreversible damage.
The life cycle of Trypanosoma cruzi in the human host. In this video, we see the life cycle of Trypanosoma cruzi in the human host. The trypanosome life cycle begins with the triotomine insect, which is infected with T. cruzi, biting a human host. Following the ingestion of blood, the metacyclic trypomastigotes are released with the feces from the insect near the area of the bite. Note that this form has great motility. Observe that the parasite enters the host through the bite site when the host scratches the site, or when the parasite moves to a region covered by mucosa. The parasite reaches the mammalian bloodstream and subsequently invades different cell types that it encounters, such as macrophages, muscle cells, epithelial cells, and neurons. In this example, the attachment of the trypomastigote form of the parasite to the macrophage surface is observed. The process of internalization via phagocytosis begins with the formation of pseudopods. During and after the internalization of the parasite, the parasitophorous vacuole assembles. Host cell lysosomes migrate toward the internalization region and fuse with the parasitophorous vacuole. The lysosomal content is released in the vacuole. However, the parasite is not affected. In the vacuole, the trypomastigote transforms into an amastigote. This transformation is accompanied by the disruption of the parasitophorous vacuole membrane. The amastigotes are released into the cytoplasm of the host cell and divide multiple times. Observe how many amastigotes are accumulating through the division process. They can occupy the entire cytoplasm of the host cell. Following division, the amastigotes transform into trypomastigotes, which show intense and constant movement that culminates with their bursting out of the cell. The trypomastigotes reach the extracellular space and, subsequently, the bloodstream. The parasites will now infect new cells.
Chagas disease is an illness spread by insects. It is common in South and Central America. Infected blood-sucking bugs, sometimes called kissing bugs, spread it. When an infected bug bites you, usually on your face, it leaves behind infected waste. You can get the infection if you rub it on your eyes or nose, the bite wound or a cut. The disease can also spread through contaminated food, a blood transfusion, a donated organ, or from mother to baby during pregnancy. Chagas disease symptoms. Chagas disease has two phases, acute and chronic. The acute phase may have no symptoms or very mild symptoms. Symptoms include fever, general ill feeling, malaise, swelling of one eye, swollen red area at site of insect bite. After the acute phase, the disease goes into remission. No other symptoms may appear for many years. When symptoms finally develop, they may include constipation, digestive problems, pain in the abdomen, swallowing difficulties. Chagas disease treatment. The acute phase and reactivated Chagas disease should be treated. Infants born with the infection should also be treated. Treating the chronic phase is recommended for both children and adults. Adult patients should talk to their doctor about whether to treat chronic Chagas disease. Two drugs are used to treat this infection, Benznidazole and nifurtimox. Both drugs often have side effects. The side effects may be worse in older people. Chagas disease is a common disease, yet every individual needs unique treatment and care. We encourage people with Chagas disease and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about Chagas disease and how to treat Chagas disease, just click on the link at description or visit www.mainmd.com. Thank you.